Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. And boy, Dr. Meyer, we have hit the deep freeze.
Woo, boy. Absolutely, we have hit the deep freeze. Yeah, I had to get up this morning, as I have the last couple mornings, and make sure that I start my car, about 10 to 15 minutes before I head to the clinic. Otherwise, the gears are not sounding like they are so happy as we roll down the road. So, yeah. But anyway, here today, happy. I'm sitting in my car outside the clinic, ready to have another great talk with you, Dave.
No, that's great. Well, let's talk about it. People have been under the weather. We've heard about lots of respiratory things, lots of flu things, and not just around our area. Seems to be a nationwide thing. Maybe it's the temperatures, maybe there's other things involved, but some folks have had a tough winter.
Really the case. In the last 3 to 4 years, we've looked into a lot of different ways to kind of help get the body healing. But so to speak, when just like on a cold day when those gears are cranking a little extra hard, when our body is under assault by an infection or some kind of intoxicant that is stressing our body, we got to keep those gears lubed up and warm. And that's ultimately what we're trying to do, is prime the immune system. And we've had a lot of folks that have tried the traditional stuff this year, and it's just the antibiotics and the steroids and for their flu and their cough and their cold, and 2 to 3 to 4 weeks in, sometimes 6 weeks in, they're just like, man, oh man, I just, for whatever reason this year, this is the year my body just doesn't seem to want to kind of clear this as easily. So that's when we start to look at, okay, what can we do to move the needle and get people's immune systems revved up again. And so, again, lots of different ways to go about doing that. But I've just been floored the more and more that we work with ozone therapy. It is all the different approaches and things you can use it for. This is one of them, and that's that subacute or acute illness where the immune system is under assault and having a hard time keeping up, and we'll have folks come in for maybe 2 to 3 IV ozone treatments, and what that's doing, Dave, that's throwing coal on the fire, so to speak. It's the mitochondria that make your energy in your body, your ATP, they need fuel. And fuel is oxygen. And 3 oxygen molecules are ozone gas. And this ozone gas has an incredible effect on your body's fuel-making ability. And so if you're ramping up your body's fuel-making ability, it is just music to the body. It's music to the body's immune system, because the immune system has more energy. And we'll have folks that even sometimes after one IV ozone treatment, that's all they need, and they are back on track again and kind of out of the ditch, so to speak.
Yeah, that's incredible. It's incredible. We heard from Pam last week, somebody that had suffered so much with pain for 30-some years, going back and forth between her bed and her chair, and really never slept a night, and has some of this ozone treatment, and all of a sudden she's like a new person.
Absolutely. Like I said, the application of this it's far-ranging. We're using it for conditions like autoimmune, inflammation, chronic pain. Believe it or not, it even has an indication for folks with macular degeneration. So macular degeneration is huge in the aging population, where we're told there's not a whole heck of a lot to do to save that vision. Maybe if you've got wet macular degeneration, they might do some shots in there with, very varied success on slowing things down. But the IV ozone the studies behind it and the research behind it and the clinical reports behind it for macular degeneration, man, huge. It's huge for that. And what else have we been seeing it for? We've got several folks coming in here now that it's a part of our toolkit now. Mm-hmm. So now they're coming in and they're, again, brain fog. They've got chronic fatigue. They're out of balance. They just feel 30 years older than their age. And in addition to the hyperbarics, now we throw in the ozone, and it is like rocket fuel. And like I said, it's bolstering the body's ability to utilize oxygen at the molecular level. And so it's rocket fuel, whether you're talking about helping with the eyes, the immune system, with inflammation, some things like rheumatoid arthritis, chronic joint pain, or like in Pam's case, where we'll many times go directly in and inject right into a knee or a shoulder or into the back. And it's phenomenal how quickly you see folks feel better with it. The other interesting aspect, and Dr. Brownstein did this during COVID, he had folks come in for intramuscular ozone shots. So folks with COVID, he was having great success as I was using ivermectin and seeing some folks do well with that hyperbaric therapy. He found this tool and it worked phenomenally. So some folks that just kind of want to come in for don't want to do a 45-minute to an hour. That's about how long it takes to do an IV ozone treatment. But others that want to come in and just do a quick acute visit with me, many of them I'll just offer an intramuscular shot of ozone, and that just really seems to perk people up fast. So lots of options. And then sometimes I'll also work on those adrenals. That's another topic for another day, but so many folks, our adrenal systems, Dave, just living the lives we live. The adrenal system is our body's ability to have stamina, essentially, and the more stress our body has over time, the less our adrenal glands put out that hormone. And so that is a big deal even for folks that are coming in for an acute illness that a lot of times is really overlooked in the traditional setting, is maybe we can bolster those adrenal glands as well, because we address those. The body also has more fuel in the fuel tank to go and fire off and help fight infection and get back into balance.
One thing that, and we need to go here, but one thing that's interesting, it sounds like the research is really behind this ozone therapy. So now, like when you talk about an IV treatment, is that just like a drip, like what we would normally, if you're in a clinic or hospital, what we would normally think of as an IV?
Right. So it's we've got an IV pole, and we've got a wonderful nurse. Nicole does a fantastic job with it, and it's a room that's probably got about 6 or 7 chairs in there. Mm-hmm. And so it's kind of a social hour for a lot of folks that come in that are working on some chronic stuff, and they get to know each other. It's a beautiful thing, and share their stories, what improvements they're seeing. But Nicole will go to our ozone machine, and she will pull out about 200 cc's of blood, just like you would if you were donating blood to the blood bank. Only this, it's called MAH, or major autolytic hemotherapy, and it is where we're not taking the blood and keeping the blood. We're taking your blood and putting ozone gas into the blood and then reinfusing it back into you. So you're not donating blood, you're getting all your blood back, but it's with a deposit of energy, with this ozone energy. And you will sit there, and we've got some wonderful snacks and some beautiful music playing in the room. It's a really nice, relaxed environment, and the session can last anywhere from about 30 minutes for some folks. Some folks, maybe a 45-minute to an hour process. So, but that's ultimately what it looks like. And, for those that are interested in maybe getting started and wondering if ozone therapy might be right for them, whether it's for pain or which approach to take with it, whether it's the IV or injecting intra-articularly, give us a call. And I'd be happy to do a discovery call with you like I do with anybody that's wanting to get started on feeling better and how do I get going. These complimentary discovery calls, about 15 minutes. We talk a little bit about your case and your story and see how we can apply what's going on in your life to what we have to offer in the clinic to get you in balance, but also on the ozone side of things. If you're like, I'm really interested in just focusing in on that ozone because I know it sounds like this is such a boost for my immunity, and because folks will also just do it for wellness.
Mm-hmm.
Just, a lot of times you think of IV drip stores where folks will go in for a glutathione drip, or they'll go in for, what's commonly called a Meyer's cocktail, just to boost themselves. Kind of the similar concept, only those bags are coming from like a distributor that with the medicine in those bags. We're just, again, taking the blood and doing a drip with added ozone in. Yes. But it's just like those drip places want to bolster you in your immune system. I think these things are like another level of getting the body amped up and in tune.
That's amazing. And the neat thing is with this, the research is there. We're going to hear this terminology, and I am all for this terminology, actually, as this Make America Healthy Again movement moves forward. Repeatable science. And so you have had repeatable science through the literature and the studies on this, and that's got to bring not only the patient but you a terrific comfort level.
Yeah, absolutely. And we do a lot with clinical trials too of things that we know are safe. We're going to try things, and that's the art of medicine, and say, well, let's try this for a couple months, and are we seeing an improvement? And if so, then we want to stay going in that direction. And a lot of these things with some of the things like ozone or hyperbaric therapy, there's so much out there that has a lot of clinical research with it.
Yep.
That has been done in Europe and across the world that we may not be quite as familiar with here in the United States, but we are becoming more familiar with it. Doctors are diving into this data and finding out, wait a second, why aren't we all doing IV ozone? Why aren't we all doing hyperbaric therapy? And so, because there's substantial data to back it. And on top of that, what I've seen in the last 3 years in the clinic is case after case after case of applying these things where you see folks make a change and their lives improve.
Yeah, when you see it in front of your eyes, that's a big test. All right, so if folks want to inquire about ozone therapy or anything else about getting on the road to wellness, what's the best way to get a hold of you?
712-339-6024. And we are at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. So give us a call. Team is happy to see you, and we're happy to get started on your wellness journey, Dave.
Very good. Dr. Meyer, stay warm, stay safe. We'll chat soon.
Sounds great. Be well, everyone.
Thank you, Doctor. Dr. Bradley Meyer of the Okoboji Wellness Clinic. You can find out more online, okobojiwellnessclinic.com.